Welcome to Health Focus, where we focus on your health. Today we're talking about a very serious topic, suicide prevention. Suicide Prevention Month is approaching, and we're fortunate to have with us the Medical Director for Behavioral Health at the Solano County Medical Department, Dr. Brent Pottinger. Dr. Pottinger, thank you so much for being with us.
Yeah, thanks for having me.
And I know you're a psychiatrist by training. I believe you trained at Johns Hopkins, one of the nation's premier institutions.
Yeah, that's correct.
And what exactly is a medical director of behavioral health? What does that entail?
So in Solano County, for any Medi-Cal beneficiaries who need mental health care, we cover the entire continuum of care, whether it's coming to our clinics to get therapy, psychiatric services, crisis services, outreach in the community, including a street medicine program. So it's very diverse, a whole continuum of mental health care. And then as well, we look at how do we improve the mental health and support the mental health of Solano County generally.
Well, we look forward to speaking to you, and also I believe we'll be speaking to your suicide response coordinator, Dr. Ms. Lori Espinoza, in a few minutes. But tell us about the whole issue of suicide and suicide prevention. How important is this as a public health issue? I realize that every death is tragic, but what is the scope of the problem?
Yeah, what we find in mental health is there's a lot of stigma and misunderstanding, so it's helpful to understand the scope of the problem because it is a big public health issue. We know that suicide rates are increasing generally over the last 20 years, particularly for the young and for different ethnic groups. We also know that ages 10 through 34, it's the second leading cause of death. So it's a common cause of death, unfortunately. And so trying to better understand what we could do to prevent suicides is really important.
I came across some information, Dr. Pottinger, in some of the literature that suggests that, in fact, we may have as many as 45,000 suicides a year in the United States and 800,000 worldwide. That's really an amazing figure. I mean, we lost about the same number of people in the Vietnam War as we lose every year due to suicide, or the number of people who die in traffic accidents is comparable. So this is a big public health issue, isn't it?
Yeah. Now, when I was in high school, there was a program called Every 15 Minutes, and that program was designed to teach people about traffic accidents and deaths, involving, traffic accidents and safety around that. I think it's every 11 minutes someone dies by suicide, and that's a CDC kind of number. So it's on par with a lot of other leading causes of death.
So who is at risk for suicide, particularly in terms of ages, for example?
So we know that there is an adolescent group, ages teenage into early adulthood, that's at high risk, and then as folks age, we know that there's older adults that have different risk factors and high risk. So across the developmental spectrum, people are at different places in their lives. The mental health challenges they're dealing with are different, so it really varies. But we want to be able to target interventions to reach those populations that are meeting them where they're at. So as people get older, they might struggle with loss of other family members and loneliness and grief and other risk factors for suicide. People who are younger in life and their brain's still developing, and they may use something that might make them do an impulsive behavior like using substances or experimenting with substances, and have a mental health condition like depression, are at higher risk for suicide, because suicide is a behavior, and when people are using substances, they're more likely to do that behavior and make a decision that they wouldn't normally make.
So in terms of risk factors, you mentioned substance use. Could you comment specifically on marijuana? There is some data that suggests that suicide risk goes up with the use of cannabis, and that in fact the incidence of other mental disorders such as schizophrenia also go up. As a psychiatrist, what's your view on that?
Well, I think generally when we work with people, we try to help them reduce their use of substances, because we know that in general many mental health conditions are either made worse or destabilized by substance use. Specifically with marijuana, there's good evidence that the development of a a chronic psychotic disorder like schizophrenia, meaning someone has disorganized thinking or experiences hallucinations, seeing or hearing things that are not there, across their lifespan once they develop this condition, people who do use marijuana are at increased risk for developing that condition. And we know that people who develop schizophrenia are at high risk for suicide, but additionally, mood disorders, meaning people experiencing depression and feeling down, are also made worse with substance use, and things like suicidal thoughts, which we want people to talk about and work with their healthcare professionals to process and manage, those thoughts can take on more power when someone is under the influence because they're not in a kind of rational state of mind.
And what are the other risk factors? Could you comment on gender, for example?
Yeah, so there's different risk factors for many different groups. So you could go into a lot of detail, and what we're trying to do in Solano County is learn more about our suicide data so we can better target different groups. But we know that there are certain times where like older males are high risk for death by a highly lethal means. So that's one example.
Right.
But I think what we're trying to do is really better understand suicide in general, so we need to get better data, because a lot of what we do in medicine is trying to think about people died by a stroke, people died by a heart attack, what were all the factors that could have been changed or prevented. But in mental health, we don't really have a good understanding yet when it comes to suicide. What was going on in the person's life leading up to that day, that time, and
Right.
see where we can intervene.
So, Dr. Pottinger, I came across a statistic that suggests that suicide might be the 10th leading cause of death in the United States. Mm-hmm. And of course, one could state, well, it's not a cause of death, it's a manner of death, like homicide is a manner of death. But still, I think there's no doubting that this is a big public health issue. And I also came across some information suggesting that in about half of cases, firearms are involved. Mm-hmm. In about a quarter of cases, and I don't want to be too graphic, it's such a painful subject, but suffocation or hanging, and then about 15% overdoses. And of course, now we're facing a fentanyl epidemic, but I understand when you're confronted with a case in which someone has tragically committed suicide, you perform something called a psychological autopsy. Can you tell us about that?
Yeah, that's become kind of a gold standard to do a structured interview with the people who knew the person well, right, and trying to understand more about their mental health history, their thoughts, feelings, and behaviors that people were observing in the time leading up to the suicide, and can put context and provide rich information about what was going on in that person's life. When someone dies by a stroke, they go to a coroner's office. We might look at the body physically, but we need to understand in mental health what was going on with someone emotionally, behaviorally. And in order to do that, you really have to go back and interview people and try to get that information. And if you do that, you start to learn about kind of themes and patterns and things that could have been going on. And that's one of the programs we're trying to implement, and we are piloting in our county, and others have done that, and that can help you then target your interventions. So for instance, we know that guns are the leading mechanism for suicide deaths, and the majority of gun deaths are suicides. So it's a highly lethal means, and in California, there's a red flag law. So if someone was concerned about a loved one who's a danger to themselves, they could compel the court to restrict access to firearms. But firearm safety and thinking about firearms in our culture is important. And one of my colleagues at Johns Hopkins used the psychological autopsy to learn about firearms culture and how it's affecting families and ways that might influence the use of a firearm in a suicide.
Are we making progress, particularly in Solano County, in trying to fight back against this problem of suicides? I don't know if I should call it an epidemic, but an ongoing pandemic, perhaps.
Yeah.
Are we making progress, and what could we do better?
Well, we can always do better, and so that's why we're trying to get better information, always increase our access to services. Another highly lethal means issue right now you mentioned is the fentanyl and methamphetamine, and when people die by overdose, we have the hypothesis that a number of those people actually died by suicide, and we don't understand well because when the person goes to the coroner, it's deemed that they just died by a drug overdose. And there's not much context to what was going on in their life. And if we better understand that, we're doing a lot to try to increase substance use treatment. So for instance, we have programs to increase use of Narcan and distribution in the community, harm reduction there, increase medication-assisted treatment for substance use disorders. So there's a lot that can be done. It's a challenging problem, but we do know that 90% of suicides are related to a mental health condition. So access to mental health treatment is really critical. And so if anyone's in a crisis or anyone needs help at any time, they can call 988. So 988 is the National Suicide and Crisis Lifeline. It's available 24/7. Additionally, any county has an access number available on the internet, and Solano County has, just like other counties, has an access number people can call anytime and they can get connected to treatment.
One of the other interesting pieces of epidemiological information I came across was that about half of the suicides in the world occur in either South Asia and India or in China. And of course, those are very populous countries, probably the two most populous areas in the world. But the reason I'm mentioning it is there's a stigma in some cultures to suicide. And also some people are driven to suicide in some cultures due to a sense of shame or embarrassment, what might be called loss of face. As a psychiatrist, can you speak to some of these cultural issues with respect to suicide? And also could you answer a question about whether asking people about suicidal ideation might increase their risk of suicide? Because that's a concern people have.
Yeah, so I'll start with the latter. So it's definitely a myth that if you ask about suicide, somehow you're going to put in someone's mind the idea that now this is something that I might do or consider, and that's false. What we know is the best practice is that we want people to feel comfortable being open and honest about any suicidal thoughts they're having, and to be working with healthcare professionals and people they trust and love to process that and not let those thoughts take on more power than they should. So when people hold thoughts like that in and are not sharing it, it takes on a life of its own, and the stress and the the feelings associated with that are overwhelming. And again, suicide is a behavior, and if someone feels like they have no hope, like there's no options, and they feel trapped, they may act on those thoughts. So it's very important, regardless of the culture and the stigma in that culture around mental health, is anyone we're working with, we want to regularly talk about suicide so that people realize it's something that we take seriously, it's important, and it's part of mental health, and there are things that we can do to help people deal with it.
But I want to thank you for taking the time to explain the clinical background and the issues relative to suicide. I understand you do a lot of outreach in street medicine as well, which is something we'll talk to Lori about. Is that right?
Yeah, so our goals are to outreach to the community, to reduce barriers to care. So one of the efforts we do is we do have a team that goes out in the community, and I go with them, and we provide psychiatric care in the community, mostly for unhoused individuals, and try to invite them into mental health treatment. And in general, it's well received, but everyone is at a place where they're at, and so we have no judgment, and our goal is to make people aware that there is help when they're ready.
Well, we're going to talk now to mental health provider Espinosa. Thank you so much.
Thank you.
Well, it's a pleasure to welcome mental health clinician Lori Espinosa to Health Focus. Such a pleasure to have you here on the set.
It's a pleasure to be here. Thank you.
And I understand that you have a position that is really very important in dealing with this challenge of suicide, that you are in fact the suicide response coordinator
Yes.
for Solano County. So maybe you could tell us a little bit, first of all, what you do as a mental health clinician and about this role you've taken on.
Well, as a mental health clinician, a therapist, so I provide, therapeutic services to clients. But as a suicide response coordinator, That's going to cover a myriad of things to include prevention efforts, intervention efforts, and postvention efforts.
So let's take them in order. What can you do to help really prevent suicides before they occur? You mentioned prevention.
The biggest thing is awareness. Having people be aware of the risks and the warning signs and not being afraid to intervene. There's a myth that, if you say suicide, someone's going to more likely think about suicide, but that's not true. If you ask someone if they're going to hurt themselves, you've probably reduced their risk of hurting themselves because they're being heard.
Right. And tell us about the warning signs, if you would, please.
Some of the warning signs include more depression, anxiety, increased substance use, isolation. You can see them contacting people they haven't talked to in a long time, giving away precious items, or in some cases, being a complete change of personality where they're calm and relaxed. It's like once they've made a decision, it takes a lot of that pressure off. And you can see them in a very relaxed mode, and it's a big change from their normal presentation.
How often do people actually just flat out discuss their suicidal intent or ideation? How often do they say they're planning on hurting themselves?
In a clinical venue, actually pretty often, because we ask them directly. But with your friends or your family, probably not so much, unless it's someone they're very close to. So that's why watching out for these warning signs and not being afraid to say, hey, are you going to hurt yourself?
Do you address the underlying issues also, like the substance abuse issues?
Oh, absolutely.
How do you address those?
We try to work on programming to give them support, do harm reduction, get them more focused on their physical health, get them working with other peers in substance use to help them make that transition away from it.
So could you elaborate on harm reduction?
Harm reduction is, okay, if I'm smoking one joint today, or 2 joints, can we do half a joint? Let's bring it down. And sometimes you can't ask someone to stop cold turkey. It's just not feasible for that individual. So we work with a harm reduction model, moving them back and into more safe things while we're teaching them coping skills that can help augment why they're using the drugs.
Mm-hmm. I'm thinking also that maybe in an age of fentanyl overdoses, having somebody with you when you're using drugs and having Narcan around.
Absolutely.
But can the public get hold of Narcan and have it in their homes?
Yes, you can contact hospitals, your primary care physician, Solano County Mental Health. There's a lot of distribution points now. Drug Safe Solano, where you can get Narcan at no charge.
So with respect to Narcan, that can be administered intranasally, so that's really so helpful to have around. It can save a life. But even if somebody has that administered to them, they need to get to an emergency department right away.
Yes.
Okay.
Yes.
So you mentioned also you counsel families after a suicide has occurred.
Absolutely.
First of all, why do you do it, and what's the goal of it?
The why is that once they have a suicide, they've been exposed to a suicide, they automatically become at higher risk for suicide themselves. It's a traumatic event.
Of course.
And unfortunately, there are cases where loved ones are the ones that discover the individual, and that's horribly traumatic.
So you're really trying to help people get through a very difficult time
Absolutely.
in terms of their own mental health and their own emotional well-being.
Yes, and having someone has lived experience. I lost my son to suicide 12 years ago.
I'm so sorry to hear that.
Well, that's why I do what I do.
Yes, yes.
It's a passion born of a tragedy, but I can make a difference.
That reminds me of some of the other tragedies that have occurred where people made a difference, like the survivors of the Holocaust who try to advocate for less violence in the world in the future. So God bless you for doing what you can after such a tragedy. That's a
Thank you.
great thing. If people want to get in touch with you or with the county, do you have websites and phone numbers that somebody who's having a crisis can?
Absolutely. When a crisis, 988, the Suicide Lifeline, is the preferable way.
Right.
And that can also link directly to our mobile crisis unit. So if they need someone to physically respond, that 988 number can get that to happen. There's also options, specifically for veterans on there. Push 1 for veteran, 2 for LGBTQ. There's text lines, lines for youth. So there's quite a few options,
Right.
and I'll be giving you all of those so that you can share them with your viewers.
We'll certainly try to do that. And I guess the real message is do something, reach out, try to help people when they're in crisis.
Yes.
And of course, in California, there also are psychiatric holes for people who are really immediately at the risk of either neglecting themselves or harming themselves. It's called a 5150.
Correct.
Now, I realize that often involves the police being there. It could be a very upsetting situation. Do you get involved in that from your point of view?
What we have our mobile crisis unit, and people are trained to go out and respond to these crises. And they may do a 5150, but more likely they're going to try to start with safety planning with the individual and de-escalate the situation. And we've had a lot of luck with that. We've got mobile crisis in several of the cities in Solano and also through our school district. And a high percentage of the calls have been able to be resolved through safety planning and then follow up with mental health care.
It's really all about prevention, isn't it? If we could prevent these mental health situations from reaching a crisis point, that makes a big difference.
Yeah,
I know
early
that
intervention.
I know, for example, with the suicide barrier at the Golden Gate Bridge, one of the things that was pointed out is that often people have a moment where they're at high risk of harming themselves, and if they could get past that moment, often they do better. Mm-hmm. Would you agree with that?
Yes, absolutely. It's called urge surfing. And if you're with someone that you believe is suicidal, stay with them, because this too shall change.
Urge surfing.
Yes.
So going from one impulsive urge to another.
No, it's riding that wave up and then back down.
Oh, I see. Okay.
Because it comes back down. It will not stay at that peak if you give it time.
I've heard the term street medicine used. Mm-hmm. In your capacity as a mental health clinician, are you practicing? I know Dr. Pottinger practices street medicine. Are you doing this together? Are you going out in the streets to help people, or is it more responding to calls?
We're not sure at this point. The position is brand new. It's being funded by a grant, and it's really in a conceptual stage. We're looking at a lot of different things.
So this is evolving as we speak.
Absolutely.
And the goal is primarily to keep people safe and diminish suicide rates and to comfort individuals who've suffered from this?
Yeah, and to get rid of stigma. A lot of people avoid getting care because of the stigma.
Right. Does the funding involve then funding for infrastructure and various other people to help you?
Absolutely, yes.
Will it last for a while, or is it limited?
It's limited, but it's several years, and that's covering that startup. A lot of things that have to happen in the beginning, but once that foundation is built, then it can be maintained. So the funding really comes in that building part.
I'm thinking that if you and Dr. Pottinger and the others in your department could see what happens, it might lead to some increase in the sort of mental health literature and knowledge about how to deal with these challenges, if it makes a difference.
That's definitely what we're hoping.
I'm hoping you can track it and really report back to us.
We're taking quite a few measures right now to increase our data quality so that we can, through the psychological autopsies, getting more data on suicide attempts. Right now, qualitatively, we know there's a lot of suicide attempts, but we don't have the mechanism to actually capture all of those right now. And that's one of the things this grant is going to help us focus on.
Do you have any advice to our viewership about how to really recognize and deal with Suicide Awareness Month, and not just for 1 month of the year, but throughout the year. Any closing advice or recommendations about just how to make this situation better in the future?
Don't be afraid to say the word suicide. Talk about it. You will be amazed if you start talking about it, how many people have been touched by it, but are afraid to talk about it.
Well said. Mental health clinician Lori Espinoza, thank you so much for sharing your expertise and your experience with us here in Health Focus, and I hope we can continue this conversation in the future.
I would love to. Thank you very much.
It's been a pleasure.
Yes.
Remember, here at Health Focus, we focus on your health.